Thank you very much for attending this workshop. We're sorry for the delay, but we started with a delay from the main conference, and we wanted to make sure that everyone can enjoy the FEPS luncheon, and thanks for being here with us in this workshop, which is organized by the Foundation for European Progressive Studies. And this session works under the title Violence, Trauma and Health, Stepping Up to Gender-Based Violence in the European Union. We will hold this workshop in English, but there is a translation to German, so please feel free to grab one of those. And for those of you who can only listen in English, please get one too, because two impulses will be held in German. Let me just give you a quick introduction of the podium. It's on my right side, Austria's State Secretary for Social Affairs, Health Care and Consumer Protection. She's bringing decades of experience in national and regional governance and a strong focus on equitable health care and public health reform. We're happy to have you, Ulrike Königsberger-Ludwig. Thanks for being with us. Next to her, we're very honored to welcome the member of the European Parliament and chair of the Committee on Women's Rights and Gender Equality, Lina Galvez. Happy to have you with us. Next to her, it's Andrea Petto. She is a renowned historian and professor of gender studies at the Central European University here in Vienna, and she's internationally recognized for her groundbreaking research on gender memory and political violence in authoritarian regimes, which is, of course, a special focus if we're talking about women and violence. Andrea, happy to have you. Thanks for being with us. Close to her, it's Nicole Greci. She's Executive Director of the Vienna Violence Protection Center, Gewaltschutzzentrum, and a leading Austrian expert on preventing gender-based violence, overseeing frontline support for thousands of high-risk domestic abuse cases each year. Nicole, thanks for being with us. Happy to have you. And maybe some of you couldn't join the morning and the beginning of the conference where Professor Bettina Pfleiderer was holding one of the two keynotes. She's a physician and scientist at the University Hospital of Münster and head of the EU W20 delegation, which was last year in Johannesburg, and a global leader in gender-sensitive medicine, as well as an international policy advocate on women's rights and safety. We're happy to have you on that panel as well. Thanks for being with us, Bettina. Later on, as a kind of surprise intervention on the podium when we're done with our impulses and the opportunity for you to also get into conversation with the podium, there are two microphones in the room that can be used at any time. Laszlo Andor will enter the stage at the end and try to fix a conclusion for us for this workshop. And our time for this whole seminar is until 3 straight, because at 3:15 everyone else will be here again together for the closing of Barbara Prammer Symposium in the year 2026. Liebe Ulrike, wir freuen uns sehr, dass du hier bist. We're happy to have you. Und ich freue mich jetzt, an dich zu übergeben für dein Einleitungsstatement. I'm now handing over the stage to you for your introduction statement.
Dear participants, thank you very much. Thank you to all the participants. First of all, I'd like to underline that I'm very glad to be here today. Well, the Barbara Prammer Symposium, well, we are focusing on, topics dealing with women's health. Last year, we had a lot of interesting topics at the Barbara Prammer Symposium. We have discussed many topics. We talked about economics, for example, and then healthcare of women plays a key role this year. And this is an important topic for us as a society. So we are aware of the frontline support. We should do much more than healthcare. So it goes beyond the healthcare provision. And women take care of their health, and this is something that can be seen from men's perspective. On the other hand, we also know that sometimes women are the manager of healthcare in the entire family. This is something that we all know, but we also have offers for women in medicine, and this is a part and parcel of a research when it comes to healthcare. So sometimes this is something that is a little bit overshadowed. This is a barrier, this is a difficulty, and this is a part of some social and population groups. So they cannot really benefit from healthcare systems. And we take the responsibility for us as women, for our health in a very difficult situation, so to say, and we wanted to strike a balance from this point of view. On the other hand, we also want to take care of the health of the people that are close to us, and in this idea, in this sense, it is very important to discuss these topics that are very topical issues, because we can see women and healthcare from different perspectives. On the one hand, we have women's health. On the other hand, we have also women in the healthcare systems. I'd like to start and break the ice with some remarks. There are a lot of discussions on this topic. How can we as a society, at the Barbara Prammer Symposium, how can we do that as social democrats? How can we show our solidarity? How can we strengthen the solidarity in the healthcare system? Well, it comes and it entails the access to the provision of healthcare systems. And we have some important highlights. What do I mean by that? We know that medicine is more and more female, and we have a lot of doctors here at the Barbara Prammer Symposium. And this is something that is 100% the responsibility of policy makers. We have a system that is dominated by men, but women should be allowed to act much better and much more. And we also have to lay the foundations in hospitals, but also in other branches. And we need to pay attention to the way in which women can take care of education of young children. Sometimes these can bring about some problems. Very often this is a burden for women. And we also have to strike a balance from this point of view. So work-life balance, which is an important aspect in medicine too, and when it comes to exerting this profession. And I'm very glad to be here today in Austria, and with other countries we can also work together, even if sometimes we are running late. And it is important to have some food for thought in order to understand how we can improve these organizations, so that we can work in an interdisciplinary way together for the primary healthcare, for secondary healthcare. It is a big benefit for all of us, for young doctors, and so that the job can become better for younger doctors. So we are talking about women, we are talking about medicine and healthcare systems. How can women be better involved and work better in the healthcare system? This is the first point. And the second point deals with care. This is another important topic. This is also a feminine topic. A lot of women are present here, and as policymakers and social democrats, we also have to reflect over that and to understand how we can work better in care and health, and so that we can live from that. We have a good income and also have better planning. So, sometimes we can't plan a weekend, and we don't have a work-life balance. So we also have children. Sometimes we don't have children, but in any case, we can't plan our weekends sometimes due to our work. So it is a big burden. So we have to understand how we can work better in healthcare systems and health and care as well. How can we have these highly qualified, employees and workers? How can we involve involve them in the big sector of medicine with a lot of challenges that we have when it comes to healthcare provision. What do I mean by that? How can we make sure that we go away from this idea of putting women aside? So in order to have something that is even more relevant from this point of view in the very big sector of healthcare, and the goal, the ultimate goal, is solidarity. How can we even become better from this point of view? So these are some remarks, and we also have a lot of collaborators in the medicine sector. This is a big challenge for all of us, and we wanted to address this challenge in the sector of women's health care. We will have a lot of food for thought today. We have a lot of panelists here, and I do think that we will understand the many tasks we have to carry out. So we have research, first of all. We need to become better in the sector of health care. We need to do much more. We need to invest more in research. For example, for women-related diseases, there are a lot of branches, a lot of things that we can do, and we can discuss them with the ministers as well that are present today. We are really involved. We are committed. For example, endometry, well, was discussed today. Why do I say that? I say that because these topics are cross-cutting, topics for women, throughout their life. And these diseases are diseases that deal with women, and we should take them seriously also. So we talked about painkillers today, we talked about pains. We want to be taken seriously. Sometimes, we just talk about like some hot water, or a bottle of hot water, or something like that. So it is also the idea of perception. We wanted to invest more from this point of view. We wanted to research much more. We wanted to pool our strength, to have more possibilities and opportunities for action, because sometimes, this is something that deals with women for their entire life, and this is a big challenge. And I wanted to be very frank and to speak very frankly. We have a lot of different perspectives. If we consider economy, if we consider male colleagues, then we see that from the economic point of view, we could do much more also. So, every month we could also have a lot of women that are on sick leave because due to diseases that were not explored enough over time. And this is something that doesn't deal just with the periods and menopause. Well, it is a new beginning. Sometimes we say, okay, so you will be well, this is just normal for you, these pains. Or many women who are told it is not like that. So we would like to consider in a more serious way also this topic. I want to be very frank from this point of view. So if today we have pain relief during menopause for women, well, in this case, then we can also understand that this also has an impact on money, economic impacts, and this is part of the women's life. Very often, these also go hand in hand with education of children, and women must pay for that, and we would like to relieve their lives from this point of view. This is something that should involve us, not just women, and then the entire society when it comes to addressing these issues. This is a very important topic, and we are very glad to have our minister that has put a lot of value on this topic. And now we start discussing all that with the projects. And I do think that we want to talk about, healthcare policy. And then there is another third point, which is quite important in my opinion. Sometimes, I don't want to be too long and too boring maybe for all of you. But anyway, when we talk about For example, my life, I can also talk from my perspective. There are so many women that have kids and children, and they also want to be successful in their job, or maybe they want to work only, and they think that they shouldn't have children because they want to be successful in their job. So how difficult it is to combine job and private life. So this kind of work-life balance from this point of view. So the idea of considering external conditions as well. So we also have to feel and perceive this responsibility and accountability. We have, I had my children in the middle of the 80s, and it was a different situation. We had a minister at that time, and there was also a discussion with an observatory for women in Vienna, and they also talked about that. So nothing has changed. This is what has been said. This accountability, this responsibility, the idea of having women that take a responsibility for everybody, for the management of children, for the health of the entire family. So nothing has changed. The situation is always the same from this point of view. So there is this kind of overwhelming responsibility, women that cannot unplug in a way. This also has an impact on the psychiatric health and mental health of women. This is particularly important, something that we should take a look at. And we know that we have a lot of cardiovascular diseases, and this is the result of a lack of awareness. And then we also have a lot of women that have very women-specific challenges and diseases. As policymakers, as parts of our society, we should place more value on that. And this is my impulse, and I'm very glad and look forward to further discussions. We all, as politicians, we can't know everything. This is the reason why we also have very younger politicians, and these topics needs to be considered in the health care policy and should be paid more attention to. Thank you very much for your attention.
Thank you very much.
And now we would like to move on to the next speaker. Nicole will be speaking German, and then we will also have international guests, and then we will also give the floor to our professor. Nicole, the floor is yours. Also, Sie haben das Wort. Thank you. Thank you very much also for the invitation, for having me. It is always so nice to be on stage and to have so many different people with different backgrounds. I'm here as a politician. We have politicians, we have researchers, we have clinicians. Before getting down to the nitty-gritty of this topic, I'd like to talk about clients because this is something that we can recognize in our clients as well. I am also responsible in charge of the violence protection centers. 60 people in total, and I'm also involved. I have many colleagues. There are a lot of aspects dealing with taking care of children. For example, we have different segments that are represented, different backgrounds, something that also deals with us and in our work. And then we also have a lot of women and assistants, for example, nurses and clinicians in the healthcare system. And we have then all different not planability, for example, and then we have replacements, for example, and we have many other aspects, for example, duty rosters, staff rosters. We are almost always available. There are also some helplines when we are not on duty. The helpline is available 365 days a year. And how can we plan round the clock, for example, holidays. How can we plan holidays? How can we make sure that women with the children can take care of their children? They can spend enough time with them. How can they find a balance also in terms of spending time with their partners? Well, for example, I'd also like to use some time for that. These are topics that are quite recurring. And then of the topics, well, we also have violence against women, of course. And then I have noted a couple of points for my keynote, for my impulse speech. Well, we could talk for hours and hours about women. It is difficult to find the right leitmotif and the kind of common thread, so to say. This is the reason why I tried to focus on violence, trauma, and gender. Well, try to focus on the most important topics, and I'd like to say something about these topics. And the points before getting down to the nitty-gritty and to the contents, I'd like to talk about the topic of the dimension of violence against women, against girls in Austria, and also the idea of having a good idea of gender-specific violence. The violence protection center is present in every single regional state, and we are talking about 25,000 people that work for this observatory in the entire national territory, not just the women, and we are advisors and we give counseling, regardless of the religious belonging, also sexual orientation, and all the different aspects. 180,000 people in Austria, and at the same time we need to be clear also in terms of our work. It is not just about the violence. We are specialized also for victims, and the focus is on the topic of violence, local violence. We have a lot of partnerships. We work hand in hand with families, with children, siblings, etc. And nevertheless, we can take a look at the studies. We can see also that this is an overall picture, and this is just the tip of the ice, so to say. And this is only 1/3 of what we can do. And you maybe know the statistics in Austria. 1 out of 3, 1 out of 5 experience violence, and we want to make it more visible and more tangible. I'd like to share some examples, and I can give you an example in a place where we have a lot of women. If we take a look at this room, what does it mean? Well, we have different rows here in the first rows or in the last rows. How many of us are also concerned by direct or indirect violence? It shouldn't be physical violence. Violence can take up different forms. We have, for example, something that is particular tangible, in something that can begin also in our society, but we also talk about the psychiatric and the mental violence, for example, fear, isolation, threats, and also humiliations. And this is the beginning of a violent relationship when we talk about violence. So sometimes it is very difficult to cope with all these points. Where does violence start? We talk about economic violence. I have, for example, an income, but I can't dispose of my income as I would like to do, and I need to ask my partner before buying something because it must be in the interest of my family. And sometimes it is something that can also deal with us. And we also have a continuation of digital violence. These dimensions of violence should be taken into account to have an idea of what is going on. Where are we today? Also in Austria, even if we have a very good violence protection system in Austria, but this is something that is looming. We have a lot of confrontation, and it is also the case as before in Austria. If we talk about health and care, well, violence can have different effects. Violent, very, very direct, indirect effects, and also, the body aspects on and but also mental aspects. We talk about depression. We have a lot of disorders, sleeping disorders. We have self-lesion. We have suicidary attitudes. Sometimes this can happen. This is something that we should be aware of. And then another important aspect, the fourth point I'd like to outline for having a common thread. What is particularly important when we talk about gender-specific violence? In Austria, we have an important point, and it's something that I cannot underline enough: prevention. Prevention, when we talk about prevention, we talk a lot about prevention. Prevention is very important. We are all aware of that. Prevention also has other difficulties. When we talk about figures, we can see that prevention is not always measurable. How can I measure all that? How much money should we invest in training, in education, in health? What can I prevent? And also the root causes of violence. Then we can see that a lot is due to stereotypes, to bias. What makes me as a man? What makes me as a woman? What is the relationship between us? How should this relationship work? We learned a lot from COVID, where we saw it at the workplace, and it was pretty clear at that time. There is a table at home. Who is in charge of that? Who needs to take care of children when it comes to schooling? Also in partnerships, for example, this is something where we are not on same level, so to say, during COVID. And this was an exceptional situation, but it was very clear, how is the burden shared in the family? How is the tasks distributed between family members? We talk about equality, fairness, and then we need to take a look at that. It is not something that we can take for granted as we would like to have it. And then there is another topic dealing with prevention, for example, independence of women and empowerment in all the different life stages. We talk about income. We need income safety. We also I needed to know, how can I make two ends join two ends meet, make two ends meet? How can I buy a house, for example, if there is a divorce, if I separate myself, or if how can be independent? And it's something that starts at in the foreground, or ahead, or in advance. All women should have the opportunity of living their life in a self-determined way, and they need a lot of support for that. And then another important point I'd like to outline is the healthcare system. And the healthcare system is particularly important for us in our work, in our job. And this is due to the fact of that there are so many people, so many women that don't go to the police or to an observatory when they suffer from violence or lesions or wounds, or when they get, for example, damaged. So they should need all that, but they're not brave enough to go to the general practitioner, to the police. So we need general practitioners and the police agents that asks the right questions. What was the pattern? How did this violence take place? So I'm also a little bit skeptical, but if I'm skeptical, then I need to take a close eye on that, to have a close eye on that. How was this violence carried out? What can I do with this information? So there are a lot of professionals in the medical sector that are also afraid. They need to feel on the safe side. We need to work with the personnel, with the staff. We need to strengthen all of them, and we also need to understand how we can react to that. So, sorry. Sometimes we have a very open reaction of the concerned person. Who can I address? To whom should I send a person when it comes to lesions and damage? We also, in the medical sector, we also need the right reports and documents and documentation. So this is particularly important for legal proceedings as well. So it is not just about what is said by the concerned person. We have Austrian media and we have some agreements. In some cases, well, the system has been improved, and then sometimes they don't just say what happened to them. So it is also a problem of the statement, of the assertions, the utterances of the victims. It is particularly important to understand how these lesions come to place, physical lesions, etc.
On the podium, and since we know all of you are experts, I'm sure everyone could talk for hours. Don't worry, I think it's fine, and you made clear points that are very necessary to focus on. I'd like to continue with the issue of special issue of violence against women now with Andrea Petto, if that's okay with you, Bettina, and then we continue with the impulse of our member of the European Parliament, Lina Galvez. So Andrea, please share your impulse with us about how sexual violence and restrictions on reproductive rights are instrumentalized, especially against women.
Thank you very much for the invitation. I'm extremely honored to be here as a faculty of the Central European University, which moved from Budapest to Austria. Thank you very much for accepting this institution. And also I'm honored to serve on the FEPS Scientific Council, and always an honor to be together with Lina in this event. And I was told it's 7 minutes, so I wrote it up to make sure that actually all the points I want to make is there. So I want to start with a story on reproductive rights, and then I will explain what is new in that story and what are the consequences for reproductive politics. Because feminists are famous of fighting successfully the fight of yesterday, so I thought I will talk about the future. What is new here? So what is the story? During the deepening economic crisis in Hungary in September 2022, a Minister of Interior changed the 1992 law on fetal protection without public consultation. The new requirement is, during the mandatory consultation before abortion, gynecologists should present pregnant women with clearly identifiable fetal vital signs such as heartbeat. It is difficult to understand the legislative imperative behind introducing this new regulation, given the number of abortions had been steadily declining. Moreover, surveys indicate that those most affected are poor women, very young, and women who already have multiple children, groups which are often view abortion as the only affordable means of birth control. The winds of change regarding reproductive rights had been blowing for decades, along with intellectuals and organized institutional preparation for contesting liberal values. So I argue that there are new elements in this regulation of reproductive rights which are emerging and designed to become central battleground in its entirely new way. So what is new here? What is new in this regulation which is so important for this workshop today? First, it is new to pass a law that is not meant to be implemented. A decree left the legal regulation on abortion access unchanged, and it was never meant to be implemented. As it cannot be implemented, the heartbeat is the mother's own heartbeat, since the fetus doesn't have own circulation at that time. It is new that a law regulating national policies aimed at drawing international attention. Its real aim was to put Hungary and the regulation on the cover of international newspapers as a horror story. It is new to use national legislation to make Hungary a helpful and very cheap reference point for other illiberal parties also aspiring to capture the state and public resources the same way. The whole PR blitz did not cost a penny. However, it is not that new, but worth mentioning that it is a part of the trend that successfully contributed normalizing the idea that gynecologists can refuse abortion even if their salary is paid by taxpayers' money. It's new that it's a largely, and which remained largely under the radar, is the way how the tech lobby leverages cutting-edge technologies to create advantages for those who can afford them, often at the expense of those who cannot. This dynamic deepens existing inequalities by embedding privilege that favors wealthier users, sometimes wealthier women. It is new that the patriotic sovereignist Hungarian government, which is allegedly waging a freedom fight against Brusselite elite, has just imported a regulation from the US without mentioning it. The opening story has nothing specific to Hungary, but it fits into the larger trend of well-organized, well-funded actors. It is new. Hungary, like other illiberal countries, not only imports these ideas, but also exports them. Hungary serves as a laboratory for different political forces within the European Union, testing rhetoric and policies before implementation. Then these policies are transferred to the rest of the world through the illiberal public intellectuals, events, fellowships, and grants from, like the Matthias Corvinus College, which just recently bought a university here in Vienna, and another one in Belgium, another one in London. Yeah. What is new is that the illiberal policy regarding reproductive rights is genus-faced, right? It has got two faces, right? It communicates to different audiences what each wants to hear, causing less conflict while maximizing its gains. As gender equality plans are preconditions for European Union funding, member countries, including Hungary, are planning to tick the box and secure the funds they can channel. The genus phase of the politics of illiberal pragmatism is also cynical, as illiberal politics is not driven by values, but only by the will to power. It is cynical power game of the new Cold War, which we are living in, which is not that cold anymore. Women's bodies become battlefield. So how does this operate, this new system? The organized, well-funded transnational policy transfer is not only about destroying what sometimes we call backlash, destroying, but also building a new normal. Attacks on reproductive rights are a part of the global and transnational movement that acts locally, attacking clinics, activists, nationally, in the framework of a legal counter-revolution, and internationally, attacking international documents guaranteeing universal human rights. It aims to unite very different forces like conservative politicians, fundamentalist religious actors, illiberal pragmatists, and warmongers globally. Their aim is to create a livable and desirable offer to liberal democracies. Much more is at stake here than the right to abortion. In Texas, relatives and neighbors are expected to report if they happen to have information about abortion and are authorized to sue the enforce a law if they are not harmed, which is an introduction to a new illiberal legal paradigm, to a liberal legal system. The members of the so-called illiberal international are not only transferring know-how, like here in the Model University, for destroying and attacking liberal human rights-based institutions, values, intellectuals, and activists, but, and this is new, they are building new institutions, frameworks for collaboration, NGOs, GONGOs, universities, think tanks. In 2020, the Hungarian government and 5 other countries co-sponsored a virtual gathering to sign the Geneva, it's a very complicated name, the Geneva Consensus Declaration on Promoting Women's Health and Strengthening Family. This document is meant to be an alternative to the Istanbul Convention against violence against women and domestic violence, and the UN Committee on the Elimination of Discrimination Against Women, the CEDAW mechanism. The Geneva Consensus Declaration, by now signed by more than 32 countries, and stated, and I quote this, "There is no international right to abortion, nor any international obligation on the part of the states to finance or facilitate abortion, consistent with the long-standing international consensus that each nation has the sovereign right to implement programs and activities consistent with their laws and policies." This dual process by which illiberal forces are not only criticizing different legal frameworks, but simultaneously building alternative institutions, capturing existing institutions, right discourses, and forcing the European taxpayers to pay for it, like in the discussion of the Agora discussion. We will hear more about this. They are creating a new language about reproduction, and this is new. So this is a social mobilization against reproductive rights and political correctness that does not just demonize the worldview of their enemies and reject the human rights paradigm, but they also offer livable, viable alternative centered on the family, the nation, religious values, and freedom of speech, which is widely attractive because it resets by identifying individuals' own choices and promises a safe, secure community as a remedy for individualism and social atomization. That explains the increasing popularity of these illiberal parties in elections, especially among women. I mean, the Fidesz is mostly supported by women. There is a gender gap in Europe and beyond. I don't know the FPÖ results, so yeah. So what can be done? 3 points. First, to understand the opposition to reproductive rights is not about opposition to reproductive rights. The liberals are using that pragmatically as a political possibility to build broad alliances and unite political actors who have not necessarily been eager to cooperate in the past. So think about the opening story. So that was just a PR stunt with the lives of the women. This is why fighting against those forces who use gender equality to mobilize hate and exclusion are imperative. Second, progressive politics faces a profound challenge. The promise of technology as democratizing force is now undermined by its commodification, which shifts power further towards non-transparent elites and corporations. And third, the only way to stop this, to address the root causes: inequality, distrust, disappointment. The progressive forces were strong at the end of the 19th century, fighting with similar challenges. So the forecast by mostly male public intellectuals, that the world is returning to the end of the 19th century is a good news for progressive politics. Thank you.
Thank you very much, Andrea. Please keep the mic. I think everyone has one on its chair. Oh. Yeah, just to make sure we have the... This is yours? Oh, okay, then you... Okay. Just to make sure that we have the right channel also for the translation. Andrea, thanks very much for these open words about well, the laboratory factor of Hungary and what is going on within Europe, and also thanks for closing with the, well, smell of hope that if we are turning back to the end of the 19th century, this also makes progressive politics strong again, since our way up started there. So this is the perfect time to hand over the mic to one of the pronounced members of the European Parliament according to progressive women's politics and policy. So thanks again being with us, Lina. The floor is yours.
So thank you very much for having me here. I think we are having a extremely important discussion, especially on how us progressive we really need to put equality at the center of our policies, because it is at the center of Extreme Right International in a reverse way. But it is. It is because they are questioning the very same idea of equality, this idea that all human beings are born with the same rights and dignity. They are challenging that. They don't believe that. It's not only among only men, women, also LGBTQI people or people from different ethnia or races. So that's the reality. They are challenging the very same idea of equality. So I serve at the European Parliament, the chair of the Women's Rights and Gender Equality Committee, and it is a battle. It is a battle every day. This is my second term at the European Parliament. I was in the committee in the previous one. I was not the chair, but in the previous one, we have a kind of consensus. And we managed really to move on in many important legislation, especially the directive on gender-based violence that was really, really important. And we have a solid majority. But we don't have that anymore because the conservative have an alternative majority with the extreme right, that it is now very interested on those topics. They were absent mainly in the previous legislation, but they are very present now because they are instrumentalizing, let's see, violence against women, identifying that violence with migrants, especially with Muslims. So they are using violence against women as a xenophobic tool or weapon, or they are using sexual and reproductive health rights in order to impose their nativist, again, racist proposals in a way. So this is central for them now. For the European Populist Party, the main party in the chamber, this topic, the topic regarding women's rights and gender equality, is the most divisive topic nowadays. So part of this group now is voting with extreme rights in certain aspects, and part is not. So we have a very, very kind of short majority still, and we are struggling really to move on forward. As I say, we did very well in the last term, And this term, we have to really look very carefully to the implementation, for instance, on the gender-based violence directive, and finally to implement what we were not able to, or to approve, sorry, what we were not able to approve, which is the consent-based legislation regarding sexual violence, that it passed in the parliament, but it did not pass in the council, especially because of Germany and France that voted against that, and at the end it was not possible to do it. So there is now on gender-based violence, we are not advising very much because we are just looking for this implementation at the consent phase, but there is a kind of a consensus that we should advance on women's health. This is even extreme right groups are happy with that. They acknowledge that there is neglection on research, on trials, and everything regarding women's health. So far, so good. But the problem arrives when we look at sexual and reproductive health rights. That is the core, absolutely the core of the battle right now. The roadmap on women's rights that was just presented on March this year, that has 8 principles. His principle 2, which is the highest standards of health. So they put it really on principle 2, the Commission, and we endorse this women's rights roadmap. So that includes promoting women's and girls' physical and mental health, including through improving access to evidence-based information on women's health and sexuality, protecting women's health by supporting and complementing in full respect of the treaty's health action by the member states regarding women's access to sexual and reproductive health and rights, ensuring respectful and high-quality obstetric, gynecological, antenatal, childbirth, and postnatal care, free from discrimination and combating harmful practice, of course, that will allow countries like Hungary do what they are doing, and some regions in Spain that are doing exactly the same, because that's why they are international and they are sharing really principles and practices. Access to affordable menstrual hygiene products and contraception, and gender-sensitive medical research, clinical trials, diagnosis, and treatments. What is not there, we just did a non-initiative report on the new gender equality strategy that will be presented by the Commission in March this year. It is specific attention on menopause that we are really pushing for, because it has a lot of ramification and a lot of implications, including in labor, why women are quitting labor market earlier than men. And normally it was, because they are having children, but many of us they are not having children anymore, or just having one child, as my case, I'm very late. This is not anymore the case. Probably it is linked to menopause and how bad we feel and how lonely we feel through that process, that we have not enough medical attention, we don't have enough social or political attention. So this is an aspect that we would like to know more. Another one that we would like to have more road to continue on these health issues is digital and mental health, especially for girls and women, because there is a lot of violence, either open violence, well, now even starting by the head of the most important country in the world, that is exercising that kind of open violence against women in the digital, and not only in the digital, but only a kind of subtle violence, especially through the business model of social media and the algorithm that has obviously a gender bias, but is the model business itself that create or promote hate and violence, because there are more clicks on that model, then it's more money, and you stay longer in this social media, so you could have more publicity, and they are doing more money. And this is really hurting girls and affecting very much their mental health. I'm mother of a 14-year-old daughter, so I can tell you very much about it. Another aspect that it is probably a bit missing is mainstreaming. This is still missing everywhere. Gender mainstreaming. So we will be presenting this mainstreaming. It's not in gender, it is on health, but the S&D, the Socialists and Democrats, we will be presenting this position paper, health as a priority across all policies, in which gender, obviously, it is very well included. Probably what is missing also in this paper, it is care. But not care in relationship with care as the care we are receiving, women are receiving, or we need to receive, but also the provision of that care. In the previous legislation, we did a care strategy just after the COVID, where we managed to include that we really need to look for the dignity, not only for people receiving care, but also for people providing care, because we know the problem is mainly there. I mean, let me say that I'm now since 2019 member of the European Parliament, but I'm an economic history professor. I've done a lot of research on work-life balance, especially on time use, and the social depletion of women in all our roles, and the economic value of care. And this, at the end, has a lot of implications, especially on health issues for women, extremely a lot of implications that are not normally considered, because we are not still assuming the importance and the value of this unpaid work, of this care work. Not for the family, because probably that will be too shameful for men, or most of men, nor for the states, because we are substituting a lot of services that normally or in another models could be provided for those states, and also for businesses and for money in general. And because of that, we have a poorer quality of life, and we are we have over-medication about many things, and we go silence in many of our illness and our problems. I would like just to go back what the main problem is, and it is very much linked to what Andrea was saying, that is this sexual and reproductive health rights. Now we have an additional problem in Parliament, that after the COVID we decided that we really need a committee on health. We didn't have before. It was just a kind of subcommittee on environment. And it was very much linked with environmental health and all the consequences of pollution and everything on health. But after the COVID, we all decided that. What is the problem now? That they want to say whatever is health, women's health, it is their competence, and we are saying, no, it's our competence. And obviously, the vision we have at the FAM committee, even including stream rights and so on women's health and women's issue, is much more progressive than in SAND, in this health committee. So now they are trying, and there are some political forces trying to let's say, to move these issues from the Women's Rights Committee to the Health Committee, and especially because of sexual reproductive health rights, because they are imposing this kind of fetus beat or whatever it is. What we are, and I would like to finish with that, what we are really discussing now in the global arena, and I agree with you that Hungary it has been a lab, but now I think the US is taking the lead on this lab, on how far we can reach on many issues, is who has the right to reproduce and who has not the right to reproduce. So there is a goal, there is an intention, there is a will to control our bodies in order to control our lives. And this is not only a political or religious goal, it is also an economic goal. They want us out of the labor market too. The student right now is asking at the European Parliament for the right to stay at home. Yes, I'm not joking. It is exactly like this. No one is forcing. It's like with abortion. Oh my God, no one is forcing no one to have an abortion. We are just talking about safe, legal abortion. And then you can't take the decision you want to take. And with labor is the same. What we really need to work is on the opportunities and to have a non-discriminatory labor market and really to work that we all have the same rights and that we have a level playing field in a way. But they are asking now because they want us, with abortion, it's a stupid thing, is this idea that if we ban abortion, we will have more babies. This is the most stupid thing in the earth. I mean, we had abortions since prehistorical times. When a woman don't want to continue with a pregnancy, we don't continue. I mean, if sometimes you have to continue because it's illegal or you risk your life or you have no access to a way to do it. But it is not true that if the abortion it is legal, the natality or fertility rates are lower. It is not true. But they are insisting that because at the end what they want is to control our bodies, to put us in a secondary place in life, and to decide who reproduce and who has not. I'm an economic historian, so I will not talk about eugenetic and everything that we know already that happened on a fascist regime in the past. But that is what we have in front of us. But let me finish just with some hope, because there is hope as well. You know this initiative, My Voice, My Choice, and this is a very, very brave initiative. I've been taking care of them very much during this month, and we managed to pass twice in the FAM committee and in the plenary. And it is such a smart proposal because it's not forcing any member state to do anything. So it's not against the treaties, it is not against the subsidiary principle, not at all. It's just saying, whatever country, if voluntarily you want to take those women that cannot have abortion in their country, you will have money. They will have money as well to do it. So extremely smart. And so probably this is a kind of a lighthouse. We have to be smarter. We cannot take things as granted because they are using our language, they are using our principles, reversing them as much as they can. Even the equality now, the right to stay at home, all these sort of things, and freedom, and we cannot stay as business as usual. We really need to be smarter than they are. They have a kind of advantage now, because it's true, they have been doing quite well in social media, and all these spin doctors, starting from Orban, he was before the spin doctor of Netanyahu, haha, surprise, surprise, but we still have the right principles, and I'm sure we were able to come back also to convince the citizens that our proposals are much better than their proposals, but we have to be smarter and more strategic. And I think my voice, my choice is a good example, and we have to be grateful for it. Thank you.
Thank you very much, Lina, and I hope we all agree on the fact that it's in our best to not interrupt all the speeches we had so far from the podium. Of course, we are totally confused with our time schedule, but there is a last impulse now from the podium from Bettina. For those of you who shared also the morning at the Barbara Prammer Symposium with us, she was one of the 2 keynote speakers. And I think she can not only add her thoughts, but also kind of sum up what we had here on the podium before we tried to at least take 1 or 2 questions from you. Please, Bettina.
Yes, so now I'm having the interesting role that this morning I spoke about European politics and introduced to you all these, the treaties and what's out there. And now I'm sort of going back and going to the practical side of violence against women. And I think maybe it's a nice summary what we've heard here, and especially what you actually said. And as you know, I'm a physician, I'm working in a hospital, and I'm working with survivors and victims of domestic violence. And so to start, the medical sector indeed is the major frontline responder in cases of domestic violence, and is the only group, I think, who can make cracks in walls, in silence walls. So our role is very important because we are the frontline responders of the dark field, which people often forget, but we are. Because 10% only ever go to the police, or only a fraction come to you. But the majority of people who are affected never show up there. But so they have appointments, with physicians and so on. So this is the chance. And so I want to talk a bit about that to make you hope. And what we do to enable the medical sector to be a frontline responder, which I think they usually don't think they are. So it's a paradigm shift, which is also something, I think it's also in research and in the health system itself, this paradigm shift. So we basically, we are more, our role is more now understood as the health sector who actually deals with the health issues, but not stop there. So usually, the health sector was something, well, they treat illnesses. Somebody comes with back pains, so he gets physiotherapy. Somebody, has some other problems, some mental problems, he just gets treated for that. But it has not been asked about the presence of violence, and there was a silence. And this, I think, it's a paradigm shift, because now we say everybody needs to ask. Even if there's no indicator, so it's a routine asking of everyone, and that's what I train, what we train, what I care, so that everybody dares to ask. And of course you should know, you have to ask someone 6 to 8 times before they actually tell you something. It's not that you ask and say, oh, thanks, you're asking. Forget about it, they won't, unless you are the 8th person to ask, but believe me, usually not. But what patients told me, or, survivors, they said, well, you are the first one who had asked, thank you. And I think that is important. They don't mind. People always think physicians, nurses, everybody thinks, oh, they are offended if you ask. No, they appreciate that you ask, but you should give them the freedom to say no and accept this no. And I think that is very important. But this is a paradigm shift, so that everybody is supposed to be asked. So, and just to convey the message, it's not okay that someone is being afraid at home, just to give messages. And even if they don't respond to it, you have given the message. And I think that's a paradigm shift. The next paradigm shift is that indeed, sex, the intersection of gender, race, and age has become much more important. So our definition in the health sector now goes way beyond partner violence, even though it's a major, major, I would say, cases are between 20 and 40. years of age of patients. However, if you just focus on partner violence, you forget all the children. And they are a huge group. Children belong, for me, domestic violence, and that's what I deal with. It's partner violence is one part, but we in the medical sector, it's a paradigm shift. We think, violence against girls, adolescents, children is as important as partner violence. It's often forgotten, but it's there. And actually the elderly. So, we have a program now which we have a focus on seeing violence against the elderly when they come to the physicians. So they see what are the typical signs, what are red flags. Elderly people are forgotten. They seem like invisible. But it's known there's increasing number of people affected by violence which are elderly. And they hardly any speak of it because they're forgotten. So you see, the paradigm shift in the health sector is, like I said, age. And, just to see the different red flags, the different background of people, different forms of violence. Of course, addictive violence is something more teenies and adolescents and young girls and women may experience, but the elderly don't usually have addictive violence exposure. They're different. That's more physical. It's neglect. It's that their needs are not met. It's economic violence, that the money is taken away or they're getting not enough support, and being food and necessities. So you have to know what age group is the person affected, what are the typical forms of violence there, what are the typical red flags, and this is a new paradigm. So you look not as a huge group of everyone, you look at individuals and their environment, and I think that's so important, this intersection of various factors. Like I said, age is one, and of course gender and race. We had heard this morning, if we have a migrant woman, you can believe that she's less believed when she talks about violence, and someone is a white woman, unfortunately, So it's like we're having all our, I would say, biases and stereotypes in our brain, and they affect how we treat someone. Like risk assessment has a strong sex and gender aspect. What do you think, how high is the risk of a patient of mine to, maybe to have violence which escalates? And often, you say, oh, she looks like, attractive or not attractive, whatever. So you don't believe that she may have escalation of violence happening. So it's all there. So that's the first paradigm. The second is that we actually say every woman should receive trauma-sensitive care and communication. That means you never know, for instance, if you're a gynecologist or, some nurse in a gynecology department, whatever, you never know if a woman you're seeing has experienced sexual violence because you don't know, she won't tell you. So we train everyone that you should treat every patient as if she had experienced. So that means we train, what is trauma-sensitive care? What should you avoid? How should you talk to someone? What is the sign that someone is traumatized? How to respond to it? So that is very important. And what is trauma-sensitive communication? Because nobody is being taught that. So this is from the practical work that we do because we think that's a paradigm shift. Everybody needs to know that. Even as a physiotherapist, don't know what patient is sitting in front, how to address someone, because you don't know. And the last one is, and that we heard before, that, of course, experience in, I say, domestic violence has long and severe health issues. And that's, don't get me wrong, I mean it in a parenthesis, this in some form is good because that forces them to go to the medical sector. That's why we have the chance to actually see them. And so what is important in this paradigm shift that we train the medical sector, and that means everything, who works. It's like the psychotherapists, it's the nurses, it's the midwives, everybody is involved in care in general with patients. What are the signs? And I don't mean, I'm not only meaning that, bruises or something or fractures, I mean the psychological signs. How does someone respond when you do something? You learn a lot from looking at someone. So that we train, so that they are sensitive to understand what are the red behavior flag. And I think that is very, very important. And for my daily work, I think that is the most important thing, that we treat everyone with respect and as if they had experienced violence. And I think that it's good that we have this paradigm shift now in the medical sector. And the thing is, however, that we have to train better, because it's the same in Austria, I know, but it's the same in Germany. We don't usually have it mandatory in med schools. So this, what I'm talking, it's mandatory in Münster, where I work, and I teach that. I teach that in gynecology. I teach this in the emergency room. I teach this like everywhere they want to hear me or must hear me. But I think that's important. We have to teach so that they don't afraid to be asked, that they know what involves trauma-sensitive communication, what involves trauma-sensitive care, what is respectful care. Because unfortunately, when I speak to survivors and victims, they have not been always treated respectfully. So many here, for instance, if they go to the medical sector, for instance, after rape, so they have been asked, why have you not run away? Why? Why? It's always the victim, the victim perpetrator reversal, the blaming. And if you do this once, you lost the victims. They will never ever talk to anyone from the medical sector because they feel they don't care. And just let me introduce a first-line responder group, which I and my team put on the focus, is dentists. Because everybody forget dentists, but dentists are brilliant frontline responder, because what you can see so much, either if they had been fractures before, or even if they had to, children when they had been sexually abused, the semen is a little bit acid, and then you see typical signs in the teeth. And so they had to, you have to learn this. And so I always say dentists see more than teeth. And they can. And it's also a paradigm shift, that's the fourth one, because it's very interesting. So many, victims tell me, well, if I have a bruise, I don't go and see my physician if it's impossible. But I'm going to see my dentist, because dentists are no physicians, they don't know anyway. So you have the unique chance, the dentists. So I think that is so important to widen the horizon, to widen the perspective, and this is happening right now. And we should work on that. And what it's also, you already talked about all these issues, the health issues. I don't want to talk about it. But what I want to say is that it's also politically important that we support train-the-trainer programs for people who know exactly what I'm talking about, and going to universities and going to places and teach this. Because like I said, it should make mandatory that every physician, nurse, midwife, whatever, should be aware of that. Should be aware what are the signs, how to communicate well, what is respect. Respect is something really weird, but people seem to forget how to be respectful when you talk. Yeah. So I think that's what I wanted to convey. And the close, for me, is domestic violence not only a social injustice, it's a medical blind spot if we don't tackle it, and one we cannot longer afford to be blind with. Thank you.
Thank you very much, Bettina. We are running out of time for a real closing round, but we are not running out of time to offer at least one or two questions. Keep them short, and if possible, address them to a special person on the stage. Please, two in the front, and I think a third one was here, so I can take all of them.
women mainly who are working in this very difficult political and economic situation. We don't have to explain it to ourselves nowadays. Well, my question is actually relates to money, which is not very, how to say, it's kind of an awkward situation among women, and we should emphasize the future. You know that the Agora program is planning the next 7 years of financing of NGOs all over Europe, and all of these feminist women's rights NGOs who are providing these services are in a difficult situation in the European Union and beyond the European Union in Europe as well. So my question is that how do you see the financing opportunities, because the foreign agent laws, any other restrictions which are making the suffering of these organizations, you know, they are fighting for their survival. And we can see that without the European funding, which is understandably increasing the military costs and so on, taking away money from the healthcare sector, from the social sector, what are our perspectives, you know, how we can do more for our own survival, you know, because I think that this is extremely important and crucial for these organizations to survive.
We keep that question, I think, with you, Lina. There are 3 other questions. I'm willing to take them, but please make them short.
As a menopause woman, I would question the view that menopause is an illness. At menopause, ovaries stop to produce estrogen, but they continue to produce testosterone until about the age of 70. So menopause women are dominated by testosterone and they are less submissive, and that's why employers don't like to employ them, because women have to be submissive. And in some cultures, elder women are for the first time in their lives respected and not exploited so much anymore. And I think in these cultures, women complain much less about menopause symptoms because they are respected. So it's a cultural thing that we view menopause women as defective.
I think this was just a contribution and not a question itself. Thanks for it, very important. 2 other small interventions, please.
Thank you. My name is Waltraud Riesner. I would have had also a question to menopause, but it's just asked. My thought was about this morning when you were talking about data. Maybe we should bring up a European database used on blockchain, which each hospital has to use so that they cannot change any data anymore. So we can divide it into women, men, and gender ones. And I want to make it fun for all here. We have heard about domestic violence. I think every man in Europe should be taken to the museum in the Margaretengürtel, where they know what can happen with 5 minutes fun or something else, and how that history has developed from the Middle Age up to now.
I love this exhibit. I saw it. I love it.
Thank you very much for this contribution. And the last intervention or question, please.
Yes. Thank you. My name is Tina Fadler. I'm the chair of the Austrian Patient Association Die Fruchtbar, Verein Kinderwunsch Österreich, and also executive committee member of Fertility Europe, the umbrella organization of like patient organizations dealing with infertility. And I am a bit tired of conservative parties saying that we do not have enough children as an argument for abortion, because I don't see any like line of thinking that we try to deal with the people who already want to have children, because there are many people who would like to have children and women who would like to have children that just don't have a partner or no money, or as in our case for our association are infertile and can't have a child. But still, although the WHO recognizes infertility as a disease, it's not in most of the European countries, it is not a disease, but just a lifestyle issue, because you can't have a child because you're old, or you just didn't care about your reproductive health. One remark, because I think that is sad, because we don't treat reproductive health as a health marker. Because in my case, for example, or in many members of our support group, women only are treated for the diseases they have for a lifetime because they want to have a child. So for 20 years you have endometriosis, but suddenly you want to have a child and it's interesting and the thing that needs to be treated. But before that, it doesn't matter that the woman has pain. And this is a serious issue and very sad. But the question I have is that, like, if conservative parties, if there's any line of argument that they understand that it's more important to look after the people that can't have children, but make others who don't want to have children have children. Thank you.
Thank you very much also for this contribution. I have to close now, but I think there was one particular question to you, Lina, which is also important for other NGOs maybe represented in the room. What is going to happen with the fundings for non-governmental organizations? And actually, it's then on you, Laszlo, to find some closing remarks for this session. Please, Lina.
So thank you for the different questions or words you have added to the discussion. And regarding the question, I'm not very optimistic. That is the reality. If I will be sorry to say, but I will not say what I don't see. What I can say is that we will be working for it. We are already working for it, because the attack to women's organizations will come by three different angles, if you want. The first one you mentioned. Now there are other priorities, and the member states don't want to increase the common budget. We have a radical common budget. It is especially for all the things we have to do together. So the budget proposal is more or less the same, but there are other priorities, and there is a big shift towards defense and security on the one hand, with a very narrow-minded vision of what is security and not a broad issue of what is security, that will change, and that will allow probably a lot of women's organizations to get into this broader sense of security. But so far, the security approach we have, or the Commission and the member states are bringing, it is a very narrow one. So this is one thing we have to work against, to make this a broader concept of security. And it is, I mean, the money, it will be going mainly to defense and security, even through dual use. With research will be dual use, everything will be dual use. So a lot of money from other aspects will end up on, as well on defense and security and competitiveness. And of course, the third sector, it is not by itself a commodified sector. And again, competitiveness is seen in a very narrow, monetarized financial way. So this is one thing. The second thing is that there is already a clear opposition and a kind of a criminalization of NGOs in general from the far right. This is so clear. They are trying every single month to cut off budget for that, to take it off all this financing to the third sector. This is very clear. But there is a third one that Andrea was mentioning. In case we continue to finance NGOs, that I hope it will be the case, that money could be full towards the wrong ones, if I say so. Yeah, so these are the three different ways you could be affected by the budget. What I can say that we are already fighting against that, and they are trying to advance on that in a very subtle way, in a very open way in a way, and a very subtle way in a way. But we are fighting, and we need to make a common front on that. I mean, the progressive is not only the S&D is. I mean, FEPS obviously, and I'm sure Laszlo will mention that, FEPS is really a progressive alliance. And we are working as well. I say we because I'm also a member of FEPS. We are working with the civil society, and we really need to work more and more and more together, especially now because our democracy, our values are in danger, especially for women, obviously. And and we will be affected also because all the social services and all the social policies will be also affected by a new austerity wave in a way. Sorry to say. Sorry.
No, thanks for being honest, Lina. Thanks very much. Something you want to add, Ulrike? Just
in aller Kürze, ich denke mir, die Diskussion hat so gut aufgezeigt.
Just very, very briefly, I think this discussion has shown that every time when our democratic values and bases are in danger, then we can see that it's always to be observed also in women's policies. And I think this is the summary of everything of what was mentioned here. And so I think that we, as a women, we have to empower ourselves. We have to strengthen one another in all aspects of our life. Women's policy is really a very important column of the social policy, and you always have to have a closer look at this and have to secure and guarantee this. It's always a very, very important issue and demand from the society, and I would like to thank you all for this very, very important inputs. And it's I'm sorry that we have to finish now the discussion, but probably it's like this. Thank you very much, Ulrike, and I am passing the mic to. Und ich übergebe das Wort jetzt an Laszlo für die Schlussbemerkungen für das Barbara Prammer Forum vom Seite der FEPS. Vielen, vielen Dank. Ich entschuldige mich, dass ich jetzt in den Rücken zudrehe. Ich bedanke mich bei den Podiumssprechern, bei den Dolmetschern und bei den Anwesenden für diesen wunderbaren Nachmittag. FEPS freut sich wirklich hier sehr, ist sehr stolz darauf, dieses Programm zu organisieren. Und ich verspreche, dass wir nächstes Jahr wieder zurückkommen werden. Und wenn Sie mal nach Brüssel kommen, bitte besuchen Sie uns, denn in Brüssel ist FEPS hier der wichtigste feministische Bewegung. Es gibt viele
most serious feminist think tank. There are many think tanks which pay attention to Women's Day and feminism once a year. And they talk about the gender pay gap and absolutely important issues, which we also pay attention to. But FEPS has a very broad view on gender equality. When it comes to foreign policy, we run a workshop on feminist foreign policy still. When it comes to Ukraine reconstruction, we pay attention to the gender dimension because it's absolutely dramatic how it's working out. Digitalization was also mentioned. What kind of bias is developing in artificial intelligence, which we also need to tackle through better regulation, and there are many, many other aspects of the gender equality which FEPS continues to work on. I think the panelists exposed the fact that we still don't exactly know the scale of violence against women and also how damaging it is to society. I saw recently a report which put Denmark to the top in terms of violence against women which is reported. Now, I'm sure it's not Denmark, but in Denmark, women are more courageous to come forward and report it, and there is greater transparency in that country than the European average. So we still need to continue exploring where exactly the difficult cases are, what is the actual damage to society, which is social, psychological, health, financial, and you name it. And we haven't yet spoken about femicide, which is violence with fatality, and it is also growing in many countries of the European Union. And we shouldn't blame it just on COVID-19 and the lockdowns and the pressure which people and families went through, because indeed there is the ideology, there is the propaganda, this ultra-conservative populist tendency which is causing a lot of damage across Europe. In Brussels, we often say that we have to find and identify the best practice, which is sometimes difficult. Unfortunately, it's always easy to find the worst practice. Andrea spoke about this, Professor Petre, which is very often Hungary is the worst practice on many of these issues. And indeed, it is true that sometimes it is a spectacle, sometimes the messaging is important because the government, which we have had in the last 16 years, was just sending this message to women that your role in society is to give birth. And then if it's through all different types of media and ideological panels, but this is indeed the purpose of this, because if it comes to abortion, Hungary is not so restrictive as Poland, for example. I think Orbán wouldn't try that. Nevertheless, the narrative is there. And the ideological messaging is there. I believe now, we hopefully get closer to the end of this long nightmare in Hungary. So he wanted, when he came to, fingers crossed, so he wanted 16 years ago, in my view, a few miracles. And one miracle would have been the demographic one. The other would have been football, but he failed miserably. He spent a lot of money on football, absolute failure. And in statistics, by the way, Hungary comes up at a very high level with spending on families. But what is the spending on families in Hungary? It's basically tax breaks to middle class and especially upper middle class, while the health provision, the health service across the board in society is getting poorer and poorer. And that's also why this so-called family policy of Mr. Orbán has been so counterproductive. You don't see any improvement. Maybe in many European countries there would be a justification to think about how birth rates could increase, but it should be through improving work-life balance, it should be better health provision, it should be better care, and in general improving relations and social cohesion within our societies. So that's the direction which we would need to, and we would like to go in Brussels, and I count on your cooperation, the panelists also in the future, and also the audience, whether in Vienna or Brussels. Thank you so much.
Thank you very much, Laszlo, Andor. Thank you very much to all the panelists. We have a short break, and in 15 minutes we will have an altogether closure of the Barbara Prammer Symposium. So enjoy a coffee break.